Exemplar, Parkinson disease. Progressive neurological disorder that primarily affects movement, decreases quality of life and increases dependence on others. Parkinson disease, pathophysiology, dopaminergic neurons are dying *. It's a progressive loss, and the more that they lose, the worse their symptoms. Dopamine receptors are throughout brain, including substantia nigra. PD clients exhibit dopaminergic cell death as a result of oxidative stress, impaired mitochondrial function and protein misfolding and aggregation, progressive loss of the dopaminergic neurons in the substantia nigra and other areas of brain, results in abnormal nerve firing patterns that cause impaired movement. Parkinson disease, facts. Usually characterized by onset of unilateral tremors that then progresses to bilateral tremors, rigidity and bradykinesia, move slow. Maybe they'll notice it in one hand, they're just shaking a little bit, and then it'll go to the second hand as well. Exact cause unknown, combination of genetics and exposure to environmental toxins. Primary risk factor is age. Average age at onset is 60 years. Early onset is considered diagnosis before 50 years. Men are at higher risk. Parkinson disease can be inherited. Distinctive characteristic: Lewy bodies in the brain, part of the diagnosis for it as well as looking at the symptom. Parkinson disease, manifestations. Motor symptoms: tremors, pin rolling. Rigidity, cogwheel rigidity. Rigidity, cogwheel rigidity. Bradykinesia. Postural instability, Parkinsonian gait like shuffle their feet. Lack of affect, very blank face, it's hard to read their expression. Muscle cramps.
Dystonia.
Small, cramped writing, you'll see changes in their handwriting, and also with the tremor, it's also very hard for them to write. Non-motor symptoms. Cognitive deficits, slow thinking. Emotional changes, depression. Sleep issues, insomnia, RLS restless legs syndrome. Constipation. Bladder issues, I.E. frequency hesitation. Skin issues, I.E. seborrhea. Anosmia, total loss of sense of smell. Orthostatic hypotension. Pain discomfort. Side note: not every client who has Parkinsonism has Parkinson's disease. Certain medications can cause Parkinsonism symptoms, and head trauma. Parkinson disease, treatments. Surgical, deep brain stimulation, try to stimulate dopamine release. Pharmacological,
Levodopa, carbidopa.
increases brain dopamine levels, reduces tremors, bradykinesia, and rigidity. Nausea, orthostatic hypotension. Effectiveness of medication can diminish over time, leading to on-off effect, sudden lack of symptom control, and unexpected dyskinesias. They start to get used to it. Sometimes you have to keep upping the dose on it, so one of the things that you want to watch is to make sure that it's still combating their symptoms, so if symptoms get worse, you want them to come back to you and let you know.
Resegeline.
Prevents breakdown of brain dopamine by inhibiting monoamino oxidase and interferes with dopamine reuptake in synapses. If taken with levodopa, it may increase risk of hallucinations. Parkinson disease. Main goals: improve functional mobility, maintain independence with ADLs, adequate bowel elimination, maintain optimal nutritional status, effective communication, and maintain effective coping skills. Enhance. Improve mobility. Encourage walking, riding the stationary bike, swimming and gardening, and ROM exercises. G. Encourage walking erect, watch the horizon, use wide-based gait. Enhance self-care activities. B. Encourage participation in social and recreation events. Avoid doing things, EADL activities, for the client to save time. Improve bowel elimination. H. Encourage adequate fluid intake, moderate fiber intake, provide a raised toilet seat. Improve nutrition. C. Monitor weight, provide supplements with meals, monitor for aspiration. Enhance swallowing. F. Consume semi-solid foods, thicken liquids, sit upright for meals. Use of assistive devices. A. Use of special utensils, use of electric warming tray. Improve communication. E. Encourage to speak slowly, look directly at listener, speak in short sentences, exaggerate pronunciation. Effective coping. I. Occupational therapist consult, possible hospital bed at home, or over bed frame with trapeze. Key points. No definitions. Negative effects of immobility. Risk factors: MS virus exposure, Epstein-Barr virus. Urological and musculoskeletal assessment, MS and Parkinson's. There's no cure for either, so all we can do is try to slow the progression, or give you medications that will keep the symptoms at bay, but it does not cure in any way or reverse. Understand the pathophysiology of both MS and PD. Clinical manifestations of MS and PD. Treatments for MS and PD. Nursing priorities.